Revolutionary Smart Lipo is the first and only laser-assisted lipolysis system to offer a minimally invasive procedure for the removal of fat. Using a high-powered ND-YAG laser, Smart Lipo is a new laser body sculpting procedure with significantly less downtime and side effects than traditional liposuction. What makes the Smart Lipo unique is the system's photothermal and photomechanical effects. The laser's hemostatic properties allow for vessel coagulations, resulting in less bleeding, less bruising, and less trauma.
Recovery time is much faster. Most of the time we tell patients to take off a day or two after the procedure and then they go back to work the next day. And finally, it allows us to tighten the skin where we could not really do this at all with traditional liposuction. And in areas where the skin was sort of loose or flabby, traditional liposuction can actually make it worse. Anesthesia into the skin, into the subcutaneous space. We'll probably be using about 200 or 300 cc's for both arms.
Before arming the laser, the patient and all persons in the treatment room must be wearing appropriate protective eyewear. We will be demonstrating the Smart Lipo procedure on the upper arms. Now, let's begin.
Usually the arm takes about 25 or 30 minutes for both arms, so it's a very quick procedure. What we do with Smart Lipo is we make tiny incisions. They're so small, in fact, that we don't even have to suture them. We thread the laser fiber under the skin, and we can actually see the tip of the laser fiber because it's flashing red. And we direct it in the areas we want to melt the fat. You see, where we've marked the patient, we have different incisions in the front and the back of the arm, as well as over the elbow and in the axilla. And this allows us to perform multiple crisscrossing tunnels of the laser fiber.
It's a strange sensation with a tiny little pinching.
We are actually penetrating very superficially. We're really just under the dermis when we're using the Smart Lipo device. So we thread it along under the skin. If we want to be melting fat deeper, we can actually move it deeper in the fatty layer. We're feeling the change in the thickness of the fatty layer, what we call the pinch test. That allows us to determine how much fat we've removed and that the removal is evenly distributed throughout the area we want to work with.
To remove the liquefied fat, you can use a 2mm cannula with a 60 cc syringe. We also can use a pump to aspirate the fat. After the procedure is completed, the area should be bandaged and a compression garment is to be worn for several days.
In terms of post-op care, we tell our patients that there will be some drainage for the first 24 hours, so they really should stay at home and relax. We ask our patients not to exercise for the first 2 weeks after the procedure. We just really want them to take it easy, but they can do their normal activities at work, and it's really easy for them. There's really very little pain because the post-op discomfort is really minimal.